Okay, here we go. We're now joined in the studio by the CEO of the Health Promoters, George Arrey. Thank you for your time, George.
Thank you so much.
And I always like finding out which radio station a person listens to. So which radio station do you listen to, George?
I listen to SAFM and I also listen to CCFM.
Woohoo! And we've got to say a big thank you to your daughter for finding CCFM on.
By accident, we were just changing stations and while we were driving and we landed onto CCFM, and since then we have not looked back.
Oh, fantastic. What's your daughter's name?
Her name is Zintle.
And you've also got another son and another daughter.
Yes, Zintle is 16 years old. My son Lita is 11, and my other daughter Maria is 4.
So Maria, she's going to get schooled, very well schooled in the ways of CCFM, hey?
Of course.
Well, we're not here to talk about radio listening habits, but we are here to talk about the work of Health Promoters Trust. So, George, the name kind of speaks for itself, but just paint the picture. What is the Health Promoters all about?
Yes, we are popularly known as the Health Promoters, but our official name is Health Promotion South Africa Trust because we are a trust organization, non-profit. We are focused on health education because, if you may know, there's a lot of investment in cure of basic the endemic diseases that are plaguing communities. The government is doing a lot to help with curative care, but we have realized that there is very little that is done in promotive care. So we have decided that we would have to intervene to help especially vulnerable communities who cannot afford health care, to educate them so as to enable them to prevent some of these diseases that are preventable.
Sure, that is incredible. So it's about stopping the people from becoming sick, rather than trying to cure
them when they are sick, because they cannot afford to get the kind of treatment that they need. So it is advisable. It's better to prevent the disease than to allow the disease plague you and then you start trying to cure it when you have no money.
Exactly.
Yeah.
So how do you guys do this, and what are some of the projects that you've been involved with?
Yes, we are we keep it quite simple. We do use highly condensed information that is free of medical jargon, and we train people of the communities, these vulnerable communities, and we have them present this information to their communities in the form of a workshop. And this, like I said, it's information that hasn't got medical jargon, so it's quite easy for the community to understand. And even though it is basically in English, but it's translated in situ by the facilitator in the native language, so that the people can properly understand.
Fantastic, because it's about getting it down to grassroots
level, so that it is easily comprehensible and understandable.
I've often said to doctors when they give a diagnosis or when they say something to me, I've said, okay, and what is that in plain English?
Of course,
because it's all grand and well to use these fancy terms and endometriosis and what have you, and you're like, I don't know what you're talking about. What is it? Just down to the basics.
Yeah. So we make sure that it is quite simple language for the people to understand, and also we use we are quite culturally sensitive because we understand that some of the things that we teach have some cultural implications. So we make sure that we create that atmosphere where the people can relate to it culturally, and so they can understand it better.
Yeah, because the cultures do differ. We've got such rich diversity of cultures in our country and on the continent. And so it is different how parents talk to a girl who's going to go through puberty is different from culture to culture. How we deal with things like, norms and standards and things like that.
course.
So in terms of the work that's being done, maybe you can just highlight one or two projects that you've done.
Yes, we have certain programs which we term the programs, like the that you have in an email address.
Oh yes,
the
sign.
programs.
Yeah.
We have the health promoter at church, health promoter at school, health promoter at the creche, health promoter at the community. So these programs, they have variations in the sense that we target different age groups and also different socioeconomic group of people. So for example, the health promoter at church, we have found out that there's lots of churches in the communities where we are based. So we are collaborating with the church administration or the leaders so that we can train someone in the church to become a health promoter of that church. So aside from speaking about gospel, once in a while you should be able to gather your congregation in another setting and maybe teach them about tuberculosis, for example. Teach them the basic information about tuberculosis, about HIV, about diabetes, about what have you, all these endemic diseases. Because the community needs to have some basic information about these things so as to be able to prevent these diseases. Health promoter at school, for example, we have trained senior health promoters who go to the community schools, liaise with the school principals, and then they are giving a slot into the curriculum of the school. And so they can be able to deliver health information to the children. Schools do have a little bit of health education, but we do it a little bit more intense with practical, in a more practical way. And we also make sure that we do it in a fun way so that children can understand easier. For example, a child that is in puberty, if you just give them a long lecture on puberty, they might not get it. We use fun games to teach about puberty. So by the time they get into real like their teenage years, they have a sound knowledge of what puberty is and how to look after themselves health-wise.
Sure, that is so fantastic. If people want to find out more, or maybe they want to connect with the organization, where can they go, George?
Yeah, there is. We have our contact number would be 073 299 7947.
That's 073
073 299 7947. And then we are also found in Facebook, www.facebook.com/The Health Promoters. The Health Promoters is one word. And we're also found in Instagram, www.instagram.com/Health Promoters Official.
Okay.
And then we're also found in YouTube, www.youtube.com/user/health promoters.
Fantastic. So there's videos that people can use.
Yes.
There's ways that people can.
And also our website is www.healthpromoters.co.za.
Wow, that's fantastic. So I hope you're going to connect with the health promoters, and let's understand even just a basic thing like making sure you wash your hands.
Those basic stuff which
so important.
And you'll be surprised that even some grown-up adults have no idea about this basic hygiene habit. And so we take it from grassroots levels, but also we also intervene to teach adults about some healthy habits which can really save lives.
Sure, so important. I learned this past Tuesday that on average we touch our face 3,500 times per day.
Wow.
So that's why it's so important to wash your hands, because by touching your face you can potentially put something in your mouth that shouldn't be in your mouth, and you can get horribly sick. So wow, that's very interesting. We were chatting to George Arrey. He is the CEO of Health Promoters. Go check them out online on their website, www.healthpromoters.co.za, or contact them 073 299 7947. George, it's been great chatting to you this morning. I really appreciate your time.
I feel quite honored being here. Thank you so much.
Thank you. Fantastic.